Everyone. It is a new week. Happy Monday. Woo. NCLEX. It is a big test. But if we just stay grounded, if we just keep showing up for ourselves, if we just keep checking in, doing what we're supposed to do, subject by subject, we can get past this test. Okay. And I am truly encouraged by all of the successes that I have seen. I'm so encouraged about that 90% passing rate that your eye is on the prize. You are focused. You're ready to go. Hi, if it's your first time joining, my name is Professor Regina, MSN RN, and I am on a journey. I am on a mission. I am taking you to the other side where you're going to have your nursing license. And so we're going to walk out this exam called the NCLEX, making sure that you have everything that you need to prepare. So one of the ways that we do that is by going through my NCLEX program. Now, my NCLEX program is a combination of all the great things that you actually need for your exam. And so you will have, if you are taking my course, and you guys know this, you will have lectures by me. You will have a question bank by me, computer adaptive exams by me, the physical books that we review, and a daily study calendar. So again, like I said, one of the reasons why my NCLEX review is so unique is because it actually comes with books. We are going to be, this is the V2 student workbook, and this is the quick facts for NCLEX. We usually work out of quick facts for NCLEX, but on today, we are going to be working out of the V2 student workbook. So our subject for today is actually lumbar puncture. It is found on the diagnostics exams page for V2. So we are going to go over that just briefly. Now, one thing that I want to remind you of is that we are growing in our knowledge by showing up for our study sessions. And we have a really big study session for the month of June. I announced it last week, and I challenged you to sign up for this study month, right? It's the study group for NCLEX, and it is called RNU. So Remar Nurse University is taking place every Monday in June. So actually, it would just be you coming to what you already are committed to, which is Mondays. I really try not to make anything difficult for you. Did you sign up for it? Yes, Erin says I signed up for it. It's a free study group. Monday. So we'll have 4 Mondays in June. We will be going over NCLEX content and the things that I normally need to devote a little bit more time to. That's why Remar Nurse University is so important, because it helps you to springboard and get to that final place of knowledge quicker. So the month of June, show up. You go to remarnurse.com/RNU to sign up. Again, super easy. It's just my website, remarnurse.com/RNU, and we're going to get a workbook. It's going to be fun. This is going to be fun. You just got to be there. Okay. You just got to be there. Okay. So, we're going to get into lumbar puncture again. Before we start, let's get in the comments and let's just do a fundamental review of vocabulary. Let's do a fundamental review of vocabulary so that when we talk about lumbar puncture for NCLEX, we are all on the same page. Now, next gen NCLEX can be tricky, and they like to call terms that we study in nursing school by common terms that maybe your patients may know. So, what is another name for a lumbar puncture? It starts with the letter S. What is another name for a lumbar puncture that your patient may say? Because your patient may not come in and say, hey, the doctor wants me to get a lumbar puncture. The patient may say, hey, I heard I was getting a what? Good job, I see it. I heard I was getting a spinal tap. And so we have to be able to be like, oh yeah, you're talking about a lumbar puncture. Now, what is the reason what are we trying to get if a spinal tap or a lumbar puncture is done? What is the goal? What are we going to collect? What are we going to test out? Good morning, everybody. Come on in. Good morning, good afternoon, depending on where you're from. Let me know where you're watching from too as well. I love to know the time zones. Exactly. We're going to get fluid. Fluid is good. More specifically, we're going to get cerebral spinal fluid. So that is one of the big indications of a lumbar puncture or a spinal tap. We are getting that cerebral spinal fluid. Now, there's a few reasons why a doctor would order a lumbar puncture. I want to know if you can just name one reason. And I believe if you can name one reason, then you can name two reasons. So give me two reasons why the doctor might order a lumbar puncture. And so what I'm trying to do now is I'm just trying to gauge how deeply you know this subject. How deep? What's the depth? Because can you give me not one, but can you give me two reasons why a doctor might order a lumbar puncture? I see Texas in the house. It's a pleasure, Texas. It's a pleasure to see you. So I see people are saying meningitis. Meningitis is the first one I was thinking of. Like you would know. Meningitis. What else do we have? Unknown fever. Patient has an unknown fever. Infection, hydrocephalus. Okay. So together as a group, we can really get down with lumbar puncture because everybody knows a little bit about it. And when we put it all together, we just grow. So check out the comments. They're really good right now. Tumors, trauma. Okay, perfect. So now that we have a warm introduction to the lumbar puncture, let's go deep. So for my audio visual learners, you know I cater to you. Lumbar puncture, this is a procedure where cerebrospinal fluid is extracted using a needle inserted into the subarachnoid space. Now check this out. You're using a needle and it is inserted into the subarachnoid space. So let me ask you this, because I'm just going to stop right here. If the doctor puts a needle into the subarachnoid space, okay, follow me, and the patient says, it's hurting, or I don't feel comfortable, take it out, should the doctor take that needle out? What say you guys? If a patient is in the middle of getting a spinal tap, a lumbar puncture, and the needle is inserted, it's in there, and the patient says, take it out. I changed my mind. I don't want to do this. Should the doctor take the needle out? Yes or no? Oh, I see some yeses, but I also see some no's. I also see some yeses. I also see some no's. What is the right answer? This is a perfect NCLEX question. This is why we show up, because we are learning. We're learning together. The correct answer is yes. The doctor takes the needle out. Why? Because the patient has autonomy. And so if the patient says in the middle of the procedure, cut the cameras, I don't want to do this anymore, take that needle out, the doctor should, in good faith, remove the needle. It is an interesting situation in medicine. Nothing is never routine. So when you become a nurse and you show up for work, be ready for the surprises. All right. So anyways, during this lumbar puncture, the needle is inserted into the subarachnoid space of the spinal canal. Now, typically, this is between L3 and L4, so the third and fourth lumbar vertebrae, or sometimes it is inserted between the fourth and the fifth, just depending on what is the goal of the lumbar puncture. This is also known as a spinal tap. Now, the most commonly known procedure or diagnostic procedure requiring a lumbar puncture, you told me it is the cerebrospinal fluid analysis. And we would be looking for deviations in the normals of what cerebrospinal fluid is supposed to look like, is supposed to behave like, the pH of it, all those things. So we're looking to assess the normals of the patient's cerebrospinal fluid. Now, another thing that a lumbar puncture can provide is therapeutic effects like pressure release, direct administration of medications to the central nervous system. So during pregnancy, we talk about epidurals and things like that. You can directly inject medication into this spinal canal through a lumbar puncture procedure, right? And also, it can eliminate harmful substances from the cerebrospinal fluid. So sometimes medication is given directly to attack bacteria like meningitis through that way. All right. Now, the cerebrospinal fluid, we talked about how it is normals and how there is abnormals. I would say be familiar with the first row here. The first row. Cerebrospinal fluid, normal findings. What should it look like? Okay. When the nurse sees cerebrospinal fluid, it should be colorless and it should be clear. It should be colorless and it should be clear. What are some alterations that cerebrospinal fluid can look like? All right. If it's not colorless, okay, if it's not colorless, then it could have what in it? What could it have in it? It could be cloudy. Oh, yes. If it's not colorless, it could be cloudy. What else could cerebrospinal fluid have in it that would make it? Bingo. I see it right here. Shout out to Whitney. Whitney says it could have blood in it. It could have blood in it. And that would indicate that the patient is having a what? What is the patient doing if there is blood in the cerebrospinal fluid? We're somebody's like, we're in the blue book. You can add these notes to diagnostic procedures. Diagnostic procedures in your blue book look like this. Okay. Exactly. So I asked, why would we see blood in the cerebrospinal fluid? It's because the patient is hemorrhaging. All right. The pressure is 60 to 20. The volume that you would be looking for is 125 to 150 milliliters of cerebrospinal fluid. And the chemistry, you're going to see a 7.32 to about 7.36 pH. Now, when we talk about the pH of cerebrospinal fluid, if you didn't even know these numbers, but NCLEX gave you 7.32 to 7.36, what would you say? What would you say the fluid was? Would it be acidic or would it be alkalotic? Are we looking at an acid or are we looking at an alkaline substance? 7.32 to 7.36. What do you say? I know this wasn't part of the review, but we do have to know acid-base balance for NCLEX. So the cerebrospinal fluid is more acidic. Yes, it is more acidic. That's what we're looking for. Okay, chemistry there, 50 to 80 milligrams of 100 of glucose, and then 50 to 60 milligrams of protein. And so those are the kind of normals. So just be prepared to speak to an interpretation of an abnormal laboratory presentation. Okay, so very, very good. Now, we are going to go into the indications or why a patient may require a lumbar puncture. And so an immediate lumbar puncture is going to be indicated, or it will be the reason for if your patient has a sudden onset of fever or altered mental status. Now, typically in babies who cannot speak, and we don't know what is going on. If you have a newborn, some parents out here know, if you have a newborn and they are coming in with an increased temperature, they are coming in with a decreased level of consciousness, and the doctors cannot articulate why this baby is behaving this way, okay, then the doctors are going to ask you if they can do a lumbar puncture on your baby. And that is a big decision for a parent to make. Have you ever been in that situation before? I have, okay? I have. So there could be a reason why a lumbar puncture would be ordered for babies and for adults. Also, you said it in the comments, probable signs of infection such as meningitis. There's other infections besides meningitis. Encephalitis is also a reason for a lumbar puncture. And then a subarachnoid hemorrhage may also be may also be a reason for a lumbar puncture. Now, non-urgent reasons. If you have idiopathic intracranial hypertension, can somebody put the definition of idiopathic? What does it mean? What does idiopathic mean? If you see somebody in their chart and the doctor writes idiopathic hyperthyroidism, idiopathic fever, okay, we are going to know that that essentially means I don't know. I can't figure it out. So we put the term idiopathic on there. Very good. Normal pressure hydrocephalus may entail a lumbar puncture. Patients who need spinal anesthesia with contrast may require a lumbar puncture. Intrathecal medications, these are medications that are injected into the layers of the spinal column, and also for cerebrospinal fluid drainage. These are also reasons for the lumbar puncture. So when we talk about NCLEX, we really want to know what it is, where it's given, why it's given, and of course, what are our nursing responsibilities. So reasons we would not give a lumbar puncture is also important. Which patients are not going to be appropriate for a lumbar puncture? Well, these patients this makes sense. If a patient has an elevated intracranial pressure, sometimes the lumbar puncture is not going to be advised for this patient because it can make all of these conditions worse. And so that's why we wouldn't want to do a lumbar puncture if a patient had thrombocytopenia, if a patient had a bleeding disorder, if a patient was on ongoing anticoagulant therapy, makes sense, if a patient had an epidural abscess, or if there is some sort of skin or tissue infection overlying the lumbar puncture site. So imagine if your patient had shingles and they were also scheduled for a lumbar puncture. It would not be best for our patient to have that lumbar puncture that would separate the integrity of the skin. All right. Yes, absolutely. I like that one too. Seizures are also going to be it's going to be a pause if we would do a lumbar puncture in a patient who was in status epilepticus. All right. Now that we know why, now that we know who, now we need to talk about you, which are your nursing responsibilities. So what do you focus on when you see the doctor writing that your patient is about to go for a lumbar puncture? Your patient is about to go for a lumbar puncture. Well, you got to get into action, because before that lumbar puncture, the nurse should obtain baseline vital signs and intracranial pressure. We are to educate the client about the procedure. Now, this is what the registered nurse does. This does not mean informed consent. Okay. When we educate the patient about the procedure, it is general information, particularly what you're going to do. So, hey, the doctor ordered you to have antibiotics, I'm going to hang this antibiotic as a prophylactic so that you don't get any infections during the procedure. Hey, I'm going to take your vital signs because it is important for me to know what your blood pressure is, what your temperature is before and after the procedure. So that is the type of education that you will be providing. And you are responsible for the NCLEX exam to know this education. You are responsible for the NCLEX exam to know education. And that's RN and PN, because PNs do what type of teachings? PNs, practical nurses, you are doing the follow-up teaching. And so you also have to take note of this right now. These are the things that we will be going over during Remar Nurse University. And so sign up for Remar Nurse University, because all the little details about your nursing care, you gotta be mindful of. All right. So educating about the procedure, finding out lumbar spine changes, observing for site abnormalities. That's you doing your assessment, registered nurses, reviewing the medications. And remember, for NCLEX, we are looking for contraindications some of the times when medications are presented. And so if a patient is on anticoagulant therapy, that is going to be a hard pause. If a patient maybe has seizure medications, we're going to want to let the doctor know about that. And ensuring that there is an informed consent. That is something that you need to be aware where it is. Okay. You need to be aware if you have it or if you don't. After the lumbar puncture, the nurse has to understand that pressure will be applied at the insertion site. The patient should lie flat in the bed for 4 to 6 hours. The patient may turn to the sides, but the head of the patient should not be elevated, or they may stay in the lateral position. Depends on how the doctor wants it. We have to ensure that there is no bleeding or cerebrospinal fluid leakage, and we are monitoring regular vital signs and also the neurological status and fluid status of our patient. Great job. Okay, so we are in the midst of preparing for NCLEX. You know, I like to do content first, and then I like to do questions. So making sure that you guys are paying attention now, okay? Making sure that you are paying attention now so that when the questions come, you're on board. So let me see. I see somebody in here passed. And that is phenomenal. Cece says, Miss Regina, in most facilities where PN and RN works, the PN has to do the teaching, not the follow-up teaching. And that could be a very true point. But remember, for NCLEX, what I'm trying to stress all the time is what the expectation is for NCLEX. And in a world of, hey, nurses, both for nurses, registered nurses and practical nurses, the registered nurse should be doing that initial teaching. So, whoa, here is the testimonial. Thank you so much, Nurse Izioma. Is that how you say it? Thank you, Remar family. Guess you guys got my RN license on the 14th of May after 24 years of graduation. Woo. That is outstanding. Congratulations. 24 years. That's most people's lifetime. That's like most of people have not lived, or that's half of people's lifetime. That's more. I mean, that's decades. Being out of school for that long, you guys have it. That means that once you learn this information, this lumbar puncture, trust me, you will find it easier when you come back to it. It never leaves. You just have to bring it back up again. Thank you so much. Nurse Ann says, hello, Remar family. I passed my NCLEX RN on April 18th using Remar. I am an international nurse from Nigeria, a repeat test taker. The first time I used Remar, both first and second attempt. Thank you. Hey, get on the live. I want to talk to you. I want to know more about it. We have real people here, real testimonials. Congratulations. Two RNs. Amazing. And so we are talking about how you can get there too with the intentionality. I love that. Community, your nursing responsibilities. Check this out. So the positioning here, I like this picture. We're going to place the patient in the lateral decubitus or sitting over the bedside table for the lumbar puncture. The insertion site is palpated and then prepped and draped in a sterile fashion. We're going to watch the physician or anesthesiologist do this. The aseptic technique must be maintained. Fluoroscopy is needed in clients with challenging lumbar spine anatomies. Woo! My goodness, those testimonials got me. Decades, countries. Nigeria, stand up. Woo! Complications, the infection makes sense after a lumbar puncture because you are entering a sterile cavity. And so anytime you enter a sterile cavity, there is risk for infection. And remember, the body, inside of the body is mostly sterile. There are only a few places where there is not sterility, like, of course, the mouth, the intestines. You're not going to have, a sterile environment there. But the rest of the body, inside of the heart, inside of the spinal canal, inside of the lungs, inside of the uterus, it should be a very clean, a sterile environment. Sterile environment. Yep, we are working out of the V2 student workbook. Do you have it? Do you have it? Talking about the complications at this point: infection, bleeding, post-lumbar puncture, headache. Yep. Intracranial hypotension. Also, cerebral herniation can happen, cerebral vasoconstriction and encephalopathy syndromes, or a patient can have radicular or back pain. These are all things that you have to be aware of before a patient goes to this procedure so you can prep for them after. Okay, so we just did some amazing, powerful, impactful studying on lumbar puncture. It didn't take us long. And that's one of the things that I love about content review. First, it doesn't take long, but it is necessary to get you warmed up to be able to answer questions. Now, the two complications I want to draw your attention to are going to be the post-lumbar puncture headache, all right, and then the cerebral herniation. These are the two complications that you could be asked about. So your nursing priority, of course, for the post-lumbar headache is prevention, all right? So we are going to tell the patient, it's very important for you to hydrate before this procedure because you are going to be having a reduction of cerebrospinal fluid, which can make your brain touch the surfaces, all right, of the skull more, and that is going to create a headache. We're also going to put the patient on bed rest, and we also might use a blood patch where we are going to be making sure that we have stopped the leakage of additional cerebrospinal fluid. Very important, because the more cerebrospinal fluid that leaves, then that means that there is a less amount of cushion for the cranium, inside of the cranium, for the brain to float in. All right. Cerebral herniation as well. We are trying to prevent that from happening. And when you see the term, if you don't know what cerebral herniation is, I do want you to look it up. But you can identify herniation. If something has a hernia, if somewhere the patient has a hernia, then what does that mean? That means that there is an outpouch, there is a busting, all right? There is people who have umbilical hernias, they're outies, right? Their belly button doesn't stick in, it sticks out. And so we don't want that herniation to happen, that swelling, that boom. We don't want that to happen in the cerebral area. So we have to make sure that the intracranial pressure stays normal or even a little bit lower. And we have to prevent the patient from having further deterioration because of it. If you have a herniated cerebrum, you are going to have cognitive deficits that can be irreversible. So, very, very important to be able to address and understand. So, as an NCLEX review, my mind is to draw you to these important points. Now, in nursing school, these things should have been introduced to you. Okay. So if you see the term herniation, or somebody asked, oh, what is a blood patch? What is a blood patch, right? If you don't know what a blood patch is, the idea is that you take a note of it and then you look it up. All right. You go and you look it up. It will take you seconds to do, but it will stick with you longer than if I just say what it is, or if somebody in the comments says what it is. You have to, during this process, be able to take that next step. And that next step is always, how do I improve my knowledge? Okay. So for some of us, it is looking up definitions. For other of us, it is saying, hey, if I'm working in the blue book, let me get out my blue book. That's your next step when I come on. For other people, it's, hey, let me check my study calendar to see if I am where I'm supposed to be, right? For other people, it's, hey, let me get into the free trial of the V2. I'm not studying with anything. So some people are like, I got the free trial, let me upgrade. So whatever your next step is, you need to be taking it. You need to be taking it because the opportunity is now. The opportunity is now. Another opportunity for everybody, no matter what your step is to sign up for Remar Nurse University. So I'm challenging you today to do this. Go to remarnurse.com/RNU and tap into my NCLEX review that I will be doing every Monday in the month of June. Every Monday in the month of June. And of course, as it is our custom, when we do our community classes, when we do our group events, the goal is for you to get your workbook, fill it out, show up to class, and really solidify the knowledge that we will be reviewing. Remar Nurse University, I started it because nursing students asked me to. They said, you need to start a school. You need to start a school. And so I didn't actually do the physical school, but boom, Remar Nurse University is for y'all. It's for y'all. Okay, let's get into the NCLEX questions about, guess what? Lumbar puncture. NCLEX questions about lumbar puncture. I am looking for a 4 out of 5 today. So let's just do 4 out of 5 and you will be on track. All right, here we go. Question number 1 says this: a new registered nurse was assigned in the emergency department. Upon assessing the following clients, who is likely urgently in need to undergo a lumbar puncture? Who is in need of an urgent lumbar puncture? Number 1, a client who sustained spinal injury. 2, a client who had sudden onset of severe weakness and seizure. 3, a client who is in pain due to lumbar stenosis. 4, a client requesting an epidural block. This is a good one. Put those comments on the screen. Also, if you have this book, you still need to print out the workbook for RNU because we will be going over additional information. So the RNU, Remar Nurse University workbook, is different. It's different. It's new information. So I don't want you to miss it. Okay, I'm asking, who needs the urgent lumbar puncture? Who needs the urgent lumbar puncture? The correct answer is going to be 2. Sudden onset of fever, weakness, or seizures could indicate a central nervous system infection. And through a lumbar puncture, this can be determined. Central nervous system infections must be dealt promptly to prevent further deterioration. Lumbar puncture may actually further damage an injured spine. If somebody already has an injured spine, we won't want to be doing a lumbar puncture. Lumbar stenosis, all right, means the narrowing is best treated with the laminectomy, and an epidural block is not considered the urgent case. Even though the pain is really, really bad during pregnancy, it would not be the priority over somebody who had severe weakness and seizures. All right, I'm moving on to question number 2. How are you going to do? A nurse is caring for a client who underwent lumbar puncture due to possible diagnosis of encephalitis. Which of the following significant chemistry in the cerebrospinal fluid is indicative of possible infection? Number 1, is it sodium? 2, protein. 3, glucose. Or 4, lymphocytes. This is the time where you show, have you studied content? Have you reviewed this content with me? Or are you like, I don't really know. I'm just guessing at this point, but I'm here to learn. I want to participate. I want to do something. Put that comment on the screen. We're talking about encephalitis, and I love using our medical terms in class because you are professionals. And so you will be speaking our language. So if I see encephalitis, if I see lumbar puncture, I'm going to be looking for lymphocytes in the chemistry. Everything else is not directly related to an infection in the same way. So significant lymphocytes in the CSF could mean infection. Lymphocytes are rare or close to zero in normal cerebrospinal fluid. Other options are normally found in the CSF. Are you 2 for 2? Are you 1 for 2? Question number 3, I am moving on. After a thorough assessment and securing informed consent, the nurse prepares the client for lumbar puncture. Which of the following interventions should the nurse implement first? Number 1, place the client flat on bed. 2, ask the client about unknown allergy to shellfish. 3, assess for rivaroxaban use for the past 8 hours. 4, have the client be NPO 8 hours prior to the procedure. Oh, I love this. This is a good one. Great question. What you gonna do? What you gonna do here? Great critical thinking question. Remember, never mind. Let me just be quiet. Let me just allow the comments to come in. All different types of answers. I see number 1. Some people are saying that's the priority. 2, asking about that allergy to shellfish. Big time. Some people are saying it's 4. Some people are saying it's 3. The correct answer here, when we talk about first priority, is number 3. We are looking for patients who possibly may be on a blood thinner, because if you're on a blood thinner, you can't get any kind of lumbar puncture. We got to figure it out first. And so rivaroxaban is an anticoagulant that could put the patient at risk for bleeding, That is why this one is the priority over the others. Not to say, and this is the thing, when you take NCLEX, these other things are important. They are very important to do, but you must be able to prioritize the importance of them. And that's the biggest thing. That's one of the biggest things is prioritization for NCLEX, and then in life too, when you're doing your nursing assignments. Okay, let's go on. Question number 4. 45-year-old female is planned to undergo lumbar puncture to rule out subarachnoid hemorrhage following onset of headaches. Before the procedure, which of the following actions should the nurse do, or must the nurse do? Number 1, Give an analgesic as prescribed. 2, hydrate the client orally and intravenously. 3, check coagulation studies. Or 4, obtain baseline vital signs. Oh, this is so good. Lumbar puncture is tricky. This is why we're spending extra time on this subject. I go over it in the V2. It's in here, but I want to make sure that you can go deep. You can dive as deep as NCLEX takes you. I'm shocked at these comments because we went over how to answer NCLEX questions. And where do I tell you guys to look for? I see a lot of number 4s. I see a lot of number 4s and I see a lot of number 2s. What do I tell you? Y'all better show up to R&U, because the major thing that I tell you, you're not doing right now. You're not doing it right now. And so we need more practice with these types of questions, because these types of questions are really, really easy, but most of us on these comments are getting them wrong right now. Correct answer is number 3, check coagulation studies. That is the primary for this patient. Why? Because NCLEX gives you the answer in the question. You know, I tell you that every single Monday and Wednesday. It's in the question. So what type of patient is this? This is not just any kind of patient. This is ruling out what? Subarachnoid hemorrhage. Subarachnoid hemorrhage. So I am looking for the nursing action that matches subarachnoid hemorrhage. And all of them look great, but there is only one that is matching this particular patient. And so that is going to be number 3, checking the coagulation studies, because we need to know the patient's clotting activity. And because this patient is suspected of subarachnoid hemorrhage, then that is going to determine whether we can safely do this lumbar puncture. Okay. And so I don't want you to miss these easy ones. These are the easiest of them all because they match top and bottom. Top and bottom. Okay. I'm moving on. Question number 5 is this. The nurse is caring for a client post-lumbar puncture. A day after the procedure, the client develops headache. Which of the following actions can the registered nurse instruct the licensed practical nurse to do to help the client? Number 1, change the insertion site dressing to prevent a brewing infection. 2, administer oxycodone, acetaminophen, 325 milligram tab. 3, place the client in a left lateral position. Or 4, apply a warm compress over the lower back. It's another great question. Delegation and assignment. You have to know what the registered nurse does, the practical nurse, the aide, and what should be passed off to the physician. Yeah. And again, I'm so glad that R&U is coming up when I'm seeing these comments, because we're going to spend the entire month of June doing this, working through these scenarios. You know the answers. When I give them to you, you know them. The correct answer here, we would have the licensed practical nurse do this to help the client. And again, where am I looking for? I'm looking for the solution in the question. It's going to be to administer that pain medication. The licensed practical nurse should be doing that. Okay, because we know that headache is very common. It's one of the most common complications after the lumbar puncture. And so we are wanting the client to remain flat. That's great. We can, give the hot compress, but that needs assessment. So we wouldn't really want to have the LPN doing that, right? And then the other one, let me look at it again. So number one, not too many people pick number one, changing the insertion site to prevent a brewing infection. Not going to do that one. We can do number two. Number three says place client in the left lateral position. Well, there's two reasons why this one wouldn't work in the same way. Number one is because the patient has a headache. So that is congruent with pain. Okay, that's congruent with pain. So we want to be addressing that pain in a real way. The second is when we talk about positioning a patient in general, who can position patients? Normally, the nurse's aide can position a patient, right? You don't need a license to do that. But even after a procedure that was a day ago, that is not going to address the pain that the patient is in. But I'm not sure. A lot of you picked number three. I'm not really sure. But in terms of the positioning of a patient, do not have an LPN doing that because it's something that you can do without a license. It's the same thing with giving bed baths or changing bed linens. The LPN is not to do that. That is not something that an LPN does. So medication administration though, yes. All right. Applying a warm compress over the lower back, there's not going to be any indication that is going to be helpful for the headache. Again, the answer is always in the question, the situation. So don't go too far looking for it anywhere else. Okay. Were you a safe nurse today? Were you a safe nurse today? Evaluate yourself. Say, yes, I was. No, I need more work. Don't worry. I have it for you. I have the work for you. What is it called? RNU. It's called RNU. And I've been doing this for a very long time. So I want you to understand that this environment is safe. This is a safe environment for you to learn. And it's so amazing because you're doing it at home in the comfort of your own domain and you're feeling good about it. You're making progress. Whether the answer was yes, I was a safe nurse, Remar Nurse University, get there. If it was no, I wasn't a safe nurse, Remar Nurse University, get there, because we are going to do more work together. And then so I can have testimonials like this. I wanted to stop by and say, I passed my NCLEX at the maximum. You took it to the max, 150 questions. Whew. Not many people could have done this. Thank you so much for everything, Regina and Mark. Don't stop helping people to obtain their license. So happy. I'm going to say, Alexander, if you were a lesser man, that 150 questions could have took you out, but you stayed in the game. And that's what it's about, being able. And you know what? Every time you show up here and you do study sessions and you just plug away at it, that's the mentality you take into the exam. I'm just going to keep showing up question after question, 150 questions. Here's another testimonial. I'm from Haiti. I came in the States last year with a little bit of English. When I saw Remar, I trusted that I could pass. Thank you so much. And I passed on my first attempt with 85 questions. Thank you, Remar. Come on, somebody say congratulations to this. I showed up with a little bit of English. And I was able to pass the NCLEX. And the NCLEX is a challenging exam. It is the lexicon in NCLEX is very challenging. So I know that means that you worked, you did the work, and you didn't let your limitations. Oh, I love this. Oh, this is good. You didn't let your physical limitations stop you. You didn't let your mental limitations stop you. Oh, this is so good. It's time for Monday motivation. It's the wheel, it's not the skill. I love it. This rolls into it. Woo! I'm in my zone right now. We're going to be talking about Zacchaeus, the tax collector. Zacchaeus, the tax collector. It's found in Luke chapter 19. If you know this story, rock with it again. I want to give it from a different perspective. If you have not heard the story of Zacchaeus, know the name. Okay, there's a song that my kids sing. I don't know if you know it. Zacchaeus was a wee little man was he. He's small. He climbed up in a sycamore tree for the Lord he wanted to see, right? He got up in a tree, all right? And I don't know how the rest of it goes, actually. Oh my goodness, I should call the kids in. He climbed up in a sycamore tree. Help me with the words. For the Lord he wanted to see. And oh, let me just tell the story because I didn't forgot the song now. Monday. Luke chapter 19. Jesus is entering Jericho. He's passing through Jericho. So like this is not a place that it's not it's not a place that he maybe have wanted to go, but he finds himself there, okay? And there's a man named Zacchaeus. And Zacchaeus was he was he was in a weird situation because he was an Israelite, but he was working for Rome. And so he was taking money from his own people to give to the government. He was not liked by the people. All right. And on top of that, not only was he taking money, he was actually stealing money that he was taking. So he would overtax the people and then take the top off like, hey. Oh, wait. Okay. And then one day when the Savior passed by, okay, here we go. I got the lyrics to the song. I got to sing this song because if I don't sing it, then I won't remember it. Zacchaeus was a wee little man was he. He climbed up in a sycamore tree for the Lord he wanted to see. And then one day when the Savior passed by, he looked up in that tree and he said, Zacchaeus, you come down, for I'm going to your house today. Yes, I'm going to your house today. Yes, there's a song. My kids sing that song all the time, and it's a really great reminder of the Bible story. So anyways, he was in a peculiar situation because he was stealing from the people and he became wealthy. And people knew Zacchaeus is one of us, but he's not for us. Man, Zacchaeus did not have a lot of friends. And I imagine people just don't become bad. That's what I think. I don't really think people are just like bad off the top. I think probably Zacchaeus, maybe he started out good, like, I'm just going to take this job. I'm going to try to make the best of it. But then after a while, you just find yourself further and further away from God. You find yourself further and further away from God. You find yourself not in a place that you want to be, but it's working. It's working. And so anyways, he's a wealthy tax collector. He's a cheater. He's a thief. But he hears about this man. And the man's name was Jesus. And he was coming to the town of Jericho. And so by the time Zacchaeus gets there, because he's a small man, he cannot see Jesus because of all the people. Jesus is the most popular person, right? He can't see him because he's a little man. So what he does is he climbs up in a sycamore tree. Now, from what I understand, sycamore trees are very slippery. They're not easy to climb. So he had to work to get his little self up there. And he's looking at Jesus. And then as Jesus passes by, he does the unthinkable. He looks up in the tree and he calls this man by his name. He calls this thief. He calls this unpopular guy. He says, Zacchaeus, get down. He says, Zacchaeus, get down from there. Boom. God calling you by your name. Has anybody ever experienced this where God, and this isn't the first time, like, where God in the Bible calls somebody by their name. God will call you out. I know he's done it to me. Regina, what are you doing? Regina, don't go there. Regina, turn around. Regina, don't do that. I mean, is it just me? God will call you by your name. And normally it's very like when God, and the thing about it is God's voice, you don't hear it, you discern it. Right? Because there's many people, there's many things speaking to you. You're speaking to yourself. Your friends are speaking to you. Your parents are speaking to you. And God is in there trying to speak to you too. So you have to be able to discern when God is saying, get down from there, right? And so, this is the thing. Zacchaeus could have been like, what? Get down. And then Jesus tells him why he's telling them to get down. Okay. Climbed up in the tree to see him. And he says to him, Zacchaeus, get down from here because I'm going to your house today. I'm coming by to see you. I'm coming to visit you. I don't care how unpopular you are. I don't care who doesn't like you. Jesus comes. He comes for those who need him most, right? He's not looking for the popular person. He's not looking for the person who is most liked. He's looking for the sick. He is a healer to those in need. And I imagine Zacchaeus was struggling with a lot. I imagine he had a lot on his mind. I imagine he didn't feel welcome. He felt like a stranger, and he was in a cycle of he was in a cycle of taking what did not belong to him. But Zacchaeus did something that we all need to do. He heard God's voice. He discerned God's voice, and he acted immediately. And not only that, he welcomed Jesus into his home. He said, yes, come on to my house, Lord. It's a mess in here. And maybe it wasn't a physical mess, but in our own hearts, when Jesus is knocking, when Jesus is saying, Charlotte, when Jesus is saying Jennifer, when Jesus is saying Joyce, when Jesus is saying Doris, when Jesus is saying Deidre, are you saying, come on in, God? It's a mess. Come on into my house, right? Because what happens is when the Lord is ready to bless you, there will be people who will look at your situation. There will be people who will look at you. And this is what they did to Zacchaeus. They began to mutter, like, this man is going to the house of a sinner. He's about to go to this man's house. He's the biggest cheater. He's the biggest crook in the city. But guess what? The Lord's blessings fall on the just and the unjust. Hey, listen, when people look at me, they say, what is she doing with Remar? There have been people who have come into my office and they will look at me and they will walk right past me and they will go to one of my employees and they'll say, are you the owner of Remar? Hey, but it's me. Me. They will look at me and they will say, surely it can't be you, the head of Remar. It must be him. It must be her. It must be somebody else. But it's me. It's me, Lord, that is standing in the need of prayer. And that's what God wants to do for you. He will exalt you. He will exalt you to where people don't even understand, how could she have done it? How could she have gotten this far? Hey, but the Lord on your side, you can do it. And so the people begin to mutter and they begin to say, that man is a sinner. But Jesus, he comes to his house. He has a conversation with the man. And when the man comes from being with Jesus, he realizes this. He says this. He says, here and now I give half of my possessions to the poor. And he says, everything that I cheated, I will give back 4 times. And this man is a perfect example of the understanding. And this is for us. This is for us because the Lord is going to bless you. I know when you get that nursing license, you are going to increase in your stature, in your wealth, but this is what you have to understand. And this is what Zacchaeus understood after spending time with Jesus. What profited a man to gain the entire world, but lose his soul? What will we get? When we get those paychecks rolling in, when we get those paychecks every 2 weeks, 3,000, 2,000, 4,000, every week, we're going to be accumulating and accumulating. But we have to understand Just like Zacchaeus, you could have all the wealth. You could have all the wealth, but if you don't have Jesus, you will not be fulfilled. You will not be right. You will be a small spiritually and physically. Okay. And so, what I love about this story, so many great reminders. I love that God looked up and called him by his name, because that says that out of a crowd of, doesn't matter, Jesus sees you where you are. And no matter what people think about you, he will come and sit with you in your house. Your body is a temple. Your body is a temple for the living God, and he will come into your heart and come into your mind, and he will sup with you. And you will come to know that whatever little that you accomplish in this world is nothing if you are not a part of God's bigger plan. If you are not a part of God's bigger plan. And that is what I love. That is what I love, love, love. Whatever little we do, God is going to multiply it. And so the takeaways here that I really liked: when you hear God calling you, when you discern that it is God who is calling you, act immediately. This is Monday motivation. And you have to be willing to discern God's voice, because there are so many things getting your attention every single day. But God's voice is still, and it is quiet, and it is going to lead you sometimes to isolation. Sometimes God is waiting for you to get by yourself so that you can really hear him. Also, remembering Zacchaeus was not a popular, well-liked man. Zacchaeus was somebody who was caught up in a cycle of doing wrong to get by, doing wrong, right? But nothing that he could have done could keep him away from God's love. Nothing that we do can separate us from the love of God. Not height, not depth, not angels, not demons, not life, not death. God's love chases after us. It runs you down. God's love will run you down to where you can't run away from God calling you. Oh my goodness. And this is the testimonial that the community gave today. Even with our physical limitations, this is what I love. Even with our physical limitations, God can exceed our expectations. I don't care if you've been out of school 24 years. God can do it. I don't care if you're a repeat test taker. I don't care if you came in with just a little bit of English. God can do it for you. What are you willing to do for a God who loves you that much? What are you willing to say? How are you willing to be bold? The Bible says if we lift up the name of Jesus, he will draw all men to him. And so it is my pleasure today to just say, remember Zacchaeus. Remember Zacchaeus. And I don't care if you didn't make it to church this weekend. You right now can say, God, that Bible story, it encouraged me to draw closer to you, because you love me, big or small. You love me however small I am now, or however big I'm going to get. You have been by me. You have stuck with me closer than a brother. And I will be bold and giving my testimony of your goodness. Oh man, you guys. Monday motivation has been served. You know what I love? I love right here. We have hundreds of believers. We have hundreds of nursing students. We have hundreds of people on our same journey today. And this is where our strength comes from. Our strength comes from the gathering together of us. Okay. On Mondays at noon, Eastern Standard Time, and Wednesdays, we do it at night. 9 p.m. Eastern Standard Time. If 2 or 3 are gathered, we know our Lord is in the midst. And so, just like I challenged you today, what is your next step? You heard God's voice calling you in that story. What do you need to do? Do you need to say, let me get down from where I am? Let me get down from what I've been doing. And then let me open up my heart, my home to Jesus and ask him to come in so I can be changed. All right. Keeping positive motivation on this journey. It is not an easy one. It is difficult to study for a big exam. You have to do it by faith. But I promise you, if you show up every day, it will get easier. It will absolutely get easier. And so when you are by yourself, just say a little prayer. Say, God, help me get through this study session. Help me make it this day. Just give me my daily bread. I need the whole meal. I don't need the whole week. I just need my daily bread for today, Lord. Whenever, let's look at what happened. Whenever we get to talking about God, enemy try to shut it down, but that's okay. I'm just going to be patient. I'm gonna be patient. I'm just gonna keep preaching God's word because I know that chains are being broken. I know that on Monday chains are being broken. And so when we get into a place where we're lifting up God's name and we're acknowledging God, that's all I want to say. All right. Okay, everybody. God is good. God is so good. God is so good. And the devil is a lie. He'll lie. He'll lie because the seed that was planted is already there. The seed that's planted is already there. All right. So, anyways, we're going to keep pressing on. We are going to keep on this journey. We are going to look to the hills from where our help cometh from. We are going to do that. And absolutely no weapon formed against this community, no weapon formed against Remar is going to prosper because we are not here on our own strength. We are not here on our own strength. We are on assignment. And I know that I won't be with you long. I know that I won't be with you long because you are just passing through. You will get your license and you will be on to the next phase. But for the rest of us and whoever comes after you, God is my strength. I'm going to be here saying the same things. You can, you will, and you must pass NCLEX. You can, you will, and you must pass NCLEX. Oh, everybody, I'm so excited for Remar Nurse University because we get to do more of this. We get to do more of this. So tap into the NCLEX review every Monday in June. Don't miss it. It's free too. That's the thing about it. It's free. So again, somebody asked if I already have your NCLEX review, if I already have these two books, do I still sign up for RNU? Yes, please still sign up for RNU. We're going to be working out of a new workbook. It's going to be specific for RNU. So go ahead and sign up for it so I can send that out to you. I'll be actually working on that today. I will talk more about it on Wednesday. And I only have a couple more weeks before it is June. So we will be starting that first week of June. So don't miss it. Don't miss it. Have a wonderful week, everybody. Go ahead and have a wonderful week. Thank you for stopping by. I will see you on Wednesday. And if nobody told you this, I love you guys so much. You making me so proud. And every testimonial that I see is encouraging me to keep going. So go ahead and share your testimonials amongst yourself and with me too as well. All right, everyone. I will see you later. Have a great week. Bye-bye.